Let me start with a basic question. Is universal health insurance, universal health care, an attainable goal?
Sure. Yeah, it can happen.
And can you get there without it being a government program?
Absolutely.
Absolutely.
I think we all agree on that.
Absolutely, no question.
Can you get there also without government regulation?
We're going to have government leadership. I mean, we can't keep having the kind of fragmented system we have. We spend an enormous amount of money on administrative costs because we have no leadership, no collaboration between the government sector and the private sector.
Can it be done without raising taxes?
We will need new money if we are going to bring in 47 million uninsured.
Absolutely no question it's going to take new money and new taxes, and maybe much of that can come from wealthier people, but it's going to take new money.
But if I'm a candidate who says I'm going to sign a no new taxes pledge, have I just said I've also just eliminated universal health care?
I think that's right. I think we have to be realistic about this, and it can't be done on existing monies.
Our scorecard asks the candidates to address 5 key issues: coverage for the uninsured, cost control, quality control, personal choice and responsibility, and electronic records. 6 Democrats responded, only 2 Republicans did. The Democrats, with some differences, are committed to universal coverage, which means health insurance for all Americans, with a big role for government and employers. The costs of their plans are significant. Estimates range from $60 to $110 billion a year. Republicans oppose government mandates requiring everyone to have health insurance. They support tax credits and personal health savings accounts to help individuals buy their own policies versus relying on government or employers. So what will be the practical impact of these 2 very different political philosophies in helping America's 47 million uninsured?
The Democrat plans are going to cover 40 to 45 million people. The Republican plans are going to cover 10 to 15 million people.
Over the last 2 nights, we've tried to form a framework for looking at the political battle over health care reform that will take place during this coming political year. We've already heard candidates in the political race criticizing some health care reforms as leading to socialized medicine. But interestingly, there is one prominent example of socialized medicine in America that even those candidates support, and it's a system that works. With more of our series, Critical Condition, here's Dr. Tim Johnson.
Socialized medicine may sound un-American, but in fact, it's exactly what we provide to our American heroes, the more than 5 million armed service veterans. They get health care that's both paid for by the government and delivered by the government. It's the VA healthcare system, and according to healthcare experts like Phil Longman, it's become one of the best healthcare systems in the country.